longer, but as you'll see, the methodology behind both of them will be the same. Okay, I'm going to talk today about the strategy of how to use your nurse life care planner. And I'm sure there's going to be a question, and if I haven't already seen it, someone's going to say, well, what's the difference between the nurse life care planner and the life care planner who is not a nurse? For example, a vocational specialist, a physical therapist, an occupational therapist, some of the psychologists that are out there. Neither one is bad, neither one is good. We all have different experiences in our own practices of what we feel comfortable with, of what we've used, or maybe we just don't know that there's somebody else out there. So why the nurse life care planner? And if any of you can kind of stop and think about a time, whether you've been in a hospital or a family member, you'll have come across a nurse. Somewhere in your lifetime, you have come across a nurse. We are in every continuum of the healthcare system. The other point to that is that registered nurses, and I think this is new for a lot of people, registered nurses have been writing plans of care since the beginning of our career. And what that means is we have been planning care, whether it's been for somebody that's been in an outpatient setting for a day, for our rehab patients who are with us for months and months, for example, in a traumatic brain injury type of setting, or for their lifetime in the case of litigation with a catastrophic type of injury. So we have had to write care plans. It's part of our scope of practice, and I'll talk about that further in the presentation, and why that